My name is Dr. John Lucio. I want to welcome you back to our YouTube channel. I practice integrative medicine and pain management in Jefferson City, Missouri, and this is my wife.
Hi, I'm Dr. Jennifer Sue, and I'm a private practicing OBGYN.
Before we start today's talk, I just want to say that there is a new link in the website for the Center for Integrative Medicine at Andrew Weil Center.
Yeah, we wanted to share that.
And we're going to put it in a slide, and there's a link that you can click onto it where you can find integrative medicine practitioners throughout the state, wherever you live.
Yeah. It used to be called the Center for Integrative Medicine. Now it's called the Andrew Weil Center for Integrative Medicine. Congratulations, Dr.
And
Weil.
actually, I checked. Yeah, I know, and I checked. Our names are not on it yet. We're just recently graduates, so we will be listed eventually. Today we're going to talk about the 5 things you need to know about fibromyalgia syndrome.
That's a good topic.
And yeah, that was requested by one of our viewers.
Mm-hmm.
I see it a lot in my clinic in pain management.
Me too. Like some of my patients will even say when they have fibromyalgia that it really knocks them out. One trip going to the store can maybe put them in a bed with pain for about 2 days. Yeah. It's pretty.
So the first thing is fibromyalgia is not just one symptom. Everybody thinks it's pain, but actually involves depression and chronic fatigue as well. Oftentimes patients come in that pain is one of their big problems, but the other things that they do mention a lot is the fatigue that goes along with it. Number 2, it is actually found more often in women than men in like an 8-to-1 ratio. And
8 to 1.
8 to 1, yeah. Unfortunately, we still don't know what actually causes it. It used to be thought that it was due to some type of viral infection, and this has now been proven not to be the case. What they feel is happening is that there's a neurochemical change inside the brain itself, so it's more of a centralized type of problem that manifests in increased pain and perception by the patient. So there's really a lot of research being done now, and a lot of the medications are actually focused on correcting the neurochemical imbalance in the brain. Number 3, this is probably the most important, is the diagnosis can be very challenging. I know many of my colleagues, when they see a patient with fibromyalgia, they kind of get despondent a little bit because they're very difficult to diagnose. In the past, it used to be that you had to get 11 out of 18 tender points to make the diagnosis. Now that has been changed again, and now it includes you have to have generalized pain all over the body, and it's got to be for 3 months, and there are scoring systems that we can use to help make the diagnosis. Now when a patient comes in to see me, I use that, but I also make sure I do a complete physical on the patient as well to make sure that we're not missing something like rheumatoid arthritis or osteoarthritis in the joint, and that may be causing the problem. But also too, if the patient hasn't had it done, I will order a thyroid panel to see if there's any issues with their thyroid, a complete blood count to rule out any kind of deficiencies, a vitamin D level, magnesium, a calcium level as well, and something called a C-reactive protein or a sedimentation rate, which actually looks at the whole body's level of inflammation. Now, I often get asked to do an automatic rheumatoid panel to look for rheumatoid and lupus and some of those other ones. I usually do not, unless the patient has some symptoms. If they come in with this generalized pain, they've had it for 3 months, they've got the depression, they've got the chronic fatigue associated with it, I'm pretty much sure at that point I'm dealing with fibromyalgia, and I do have to just rule out some other vitamin deficiencies or thyroid issues and anything else going on. But I don't automatically draw the rheumatoid panel on patients.
I wanted to ask him something because he deals with this every day. Would you rather draw a C-reactive protein for a marker for inflammation or a sedimentation rate?
Actually, sometimes I will do both. Remember, there are 2 different types of reactants, depends on one's acute phase versus a chronic phase reactant. There's not one single drug that is used for the treatment. So in other words, if you had an infection, you get a specific antibiotics. For fibromyalgia, there's not one single drug, and that has to do with the fact that we really don't know what causes that chemical imbalance or chemical malfunction in the brain to start all this. And so you see patients being started on drugs that do many different things and in the brain itself, such as Elavil, another medication called Lyrica, Sabella. These probably have the best evidence of working in the science right now. The least effective, and that includes narcotics, steroids, non-steroidal anti-inflammatory medications like ibuprofen or naproxen, and that's really strange because you see a lot of physicians prescribing this. But the reason it doesn't work so well is because, as I mentioned before, fibromyalgia is more of a problem in the brain itself and the neurochemical malfunction. And sadly, I do get a lot of patients that are referred to me by other physicians who are on high-dose narcotics that were started because they could not treat them any other way. And they started giving them narcotics. Of course, it didn't work. They started escalating the dose, and before you know it, now the patient are now have a very high tolerance, and now we have another issue to deal with as well. Now, there are some integrative methods that we use as well, and I mentioned the conventional medicines that we use just so you're aware, but I like to focus a little bit on the integrative side as well. So when I see a patient, one of the first things I do, I start asking a lot of the history, as I mentioned before, where the pain is. If someone comes in and just have pain on one side of the body, then I start thinking this is probably not fibromyalgia. I'm really starting to, if they start mentioning widespread pain everywhere and it's lasting for 3 months or more, then I start thinking maybe this is probably fibromyalgia. And some of the things that I start looking at too is their diet. Now this is kind of surprising to some patients. In fact, I got critiqued by one of my patients who said and accused me of being more of a dietitian. I took that as a compliment. She didn't mean it that way. But it turned out she was more seeking narcotics at the time, so she was a little bit frustrated with me. But there are some dietary changes I do ask the patients to make when I started on fibromyalgia. One of which is I try to decrease the amount of foods that cause inflammation. And that's a very positive thing for a lot of patients. Unfortunately, it does take time to adjust their diet and make them feel better.
I tell them it's actually really easy to do. It's all in your food cabinets and refrigerators already. It's just cooking with olive oil and eating more vegetables and fruits and less animal protein. And on the side note, a lot of our patients love when we talk about olive oil and how most of us, when we cook, we keep the olive oil right by the stove because it's handy and we put it in, cook, put it in. Actually, they'll denature the olive oil, so keep it away from heat and into your cupboard and then just take it out when you need it. And smell it. If it smells rancid, then it's not going to have the good properties.
In addition, I also encourage patients to get into some type of exercise program, one that they can tolerate. Now, a patient with fibromyalgia will oftentimes have a lot of problems doing some very simple exercises. They're not equipped at that point to get involved in some really strenuous exercising. So they have to experiment a little bit and they have to find the exercise that suits them. It's extremely important for them to continue with that.
Tai Chi is very effective. Tai Chi can be found in most communities. Just to go into a Tai Chi class, that helps fibromyalgia a lot.
Yeah, it's more of a gentle type of movement.
Tai Chi, Qigong. I remember the first time we saw that Qigong, we were advertising it for our wellness classes at the Capitol Ritz Banquet Center. And we were afraid people would think it was a cooking class.
The other thing is mind-body therapies, and oftentimes I will screen patients for depression, or I'll look for it if I see it in their history, and send them to our behavioral health department, kind of help them deal with some of that, and to also help them with some coping skills. This is very effective, and so when patients come in, we're dealing with a lot of different levels of treatment for them. It's not just 1 or 2 drugs and then maybe mind-body therapies. There are some supplements too that I start to encourage patients to start, including omega-3 fatty acids, which are anti-inflammatory. I also make sure I measure their vitamin D, so if they're deficient there, I will replace that as well. When I draw the CBC, the complete blood count, I'm looking for any type of anemias, and of any type of folate, indication of folate or B12 deficiency, and I will pursue that as well and start them on a supplement if required. Now, I often get asked too if there are any specific botanicals that can be used, and I can tell you that the evidence isn't as strong with botanical choices for fibromyalgia, although there are some general recommendations that I do try with the patients. Number one, I will start them on turmeric and ginger because those are both anti-inflammatory. I consider St. John's wort, especially if they have depression. And there's something called SAMe, S-A-M capital E, which is used for depression, also helps with pain. The evidence isn't so great with it, but it's if patients are suffering from side effects of the conventional medications, then I'll start introducing some of these other ones.
Taken by itself will help generalized inflammation, which is what we want in patients with fibromyalgia. Some of you remember with gut health that if you have an inflamed gut, then we told you to take turmeric but with black pepper because the black pepper will help it. In those cases, the black pepper will keep the turmeric in your gut, in the intestine, to help treat the intestine specifically. So if you want generalized inflammation to go down, take turmeric without the black pepper. If you want it for the gut health and gut inflammation, then you keep it in the gut using black pepper. And most supplements will say turmeric with black pepper or not.
Right. The other botanicals that have been recommended include rhodiola and ashwagandha. We'll list those in a separate slide. I do want to reinforce to people that if you have fibromyalgia, I've noticed a lot of pain physicians will treat that with what they call trigger point injections, and that's basically injecting those tender areas. This is not an effective treatment. If you're actually getting results with those type of injections, you probably don't have fibromyalgia. You have something else going on. So last couple things I want to mention is kind of a bonus. This is about the sixth thing has to do with marijuana. And I bring this up because I get this request about 5 times a week to be used with my fibromyalgia patients. And it just became legal medicinally in Missouri this past year, and we still haven't gotten guidance on how to prescribe it. But I can tell you that I've been following this for the last couple of years, and the studies are back and forth. They're not completely definitive. I think the jury is still out whether it's truly effective. You bet I get patients that come in and they say they went to Colorado and they ate a gummy bear that had marijuana and they feel incredibly great after taking it. That's fantastic for them. But again, what I do to patients, I try to give them what is the best science, what it shows. And for right now, it is not definitive, not to say in the next year, because there's a lot of studies going on that newer things will come up. The other interesting thing that I came across is the use of IV nutrient therapies for fibromyalgia. And that to me is still an untapped area. And what they discovered on one study that I read, that patients received this treatment had really significant relief in pain as well as increase in their functional abilities. And that's important because, as I mentioned, one of the things that patients complain about the most, and pain is there, but also their limitations in their functional abilities because of their fibromyalgia.
Nutrient therapy is not as bad as it sounds. You sit there and you receive IV nutrients just for about 20 minutes to 45 minutes, depending on how fast you can tolerate the fluids going in. So it's really handy if you cannot have a gut that tolerates nutrients. Like my father, he tends to get nausea with some of his medications, so it was really helpful for him to get IV nutrient therapy because he was both dehydrated and lacking in nutrients.
That's it for today, everybody. I hope you enjoyed this brief talk about fibromyalgia. And if you have any questions, please relate them to us, either Facebook or through YouTube.
And also, please comment below. We love your comments. And our next topic is going to be prevention of burnout and self-care, especially if a lot of you guys are in the healthcare field or taking care of a family member.